It takes a lot of logistical work to collect 400,000 signatures across the state of Washington. There's a mountain range going down the middle of it. And so this is also an incredibly important event for us to get petitions into people's hands so that they can get out there and start having this conversation with the public, so that they can start collecting those signatures, building support for a real universal healthcare system, which is what brings us all together. And so I want to think of today not just as, you know, an excuse to get the family together, an excuse to watch a good movie, an excuse to rub elbows with Michael Moore, but also the real beginning of and what's going to be a really amazing journey. And I think that if we support each other and work together really hard and continue to build this thing that we've started, we will get this on the ballot and we will have healthcare justice for all. So thank you, everyone. I'm so excited to my very first viewing of Sicko, actually. It's one of those embarrassing things if you're in the biz to not have seen it. So I can finally fix that. And I'm so excited to watch it with all of you.
Hey guys, I'm Catherine Lundowski, and I just wanted to say really quick a couple of things. One, what was it? I want to say a big thank you to the Red Berets for all of these Red Berets. I was filling all the bags and I was just amazed at all the work and the beautiful craftsmanship that went into them. So thank you to the Red Berets. Also in your captain's bag, which I hope you can pick up before you go, please try to pick them up. And if you are like a county lead, take more for your county. But inside we have hand sanitizer here, but one of them was broken open and oops, sorry, this one is not the one that was broken open. Anyway, so what I wanted to say, it's got that, it's refillable. It's refillable and it's got our nifty logo on it. Okay, so get it. Yeah, it's beautiful. Okay, so make sure you pick. There's some in your bags and there's extras too. Okay, right on. Right. All wave. Dogs like that.
We play our song. It's too quiet. Play our try out.
Yeah, I turned my phone off, so I'm gonna turn it back on.
Who's not sick of the song yet? Who wants to get fired up?
Get fired up.
Okay.
Prepare to dance.
Medical, because healthcare is a right. Medicare, and the U.S. all alike. And the best healthcare is a single table. Now's the time to finally put it on the table. The health insurance and a drug one healthcare reform I win. They're shocking up in pain for advertisement never ends. They want your benefits, and Wall Street friends. So we need to know the CEOs and corporate
Slide in with you?
What? Say what? Okay, that I got nothing. There. Oh, oh no.
Oh,
Okay, sorry.
Too many OBGYNs aren't able to practice their love with women all across this country.
Their love with women. That's how I
You're
felt when I
right.
was thinking that going.
Right.
John, I don't want to have any more than anybody else I already have out there.
This is Adam.
What? What noise? I don't know. I've got the cell phone connected to the light.
Progressive Democrats of America.
I'm sorry.
Okay, now can you hear me?
Can you hear us now?
Yes.
And we can hear you. So much for joining us today for our launch event for our 2022 campaign. It's not our first rodeo, but we haven't had Michael Moore before. So we just watched an amazing documentary about the US healthcare system. I think in so many ways it's, puts in so much context. It's a pre-ACA movie. Thank you, Donna. I don't know, is Michael with us yet?
I don't think he's here yet. So he asked me to send him the email, which I did like an hour before, because he gets 1,000 emails a day. So hopefully he'll join us. I told him it would be about 11:15.
Okay, well,
We can ask Donna. Donna's here.
yeah, thank you so much. How are you
I'm
doing?
happy to fill in until he gets here.
Thank you.
Thank you, Donna. Of course. Thank all of you for being there. You look great.
So Donna, can you tell me a little bit, we are gonna have audience questions and everything, but just a little bit about Progressive Democrats of America, healthcare, how you see the movement for universal healthcare in this moment.
Sure, of course. And first of all, thank all of you for coming out on a Saturday morning and watching a 15-year-old documentary. It's hard to believe that it's been 15 years now since the documentary was made. Progressive Democrats of America, I joined right after the movie was made when I testified to the House Judiciary Committee about medical debt and bankruptcy and what had happened to my family. And a young activist came up to me afterwards and talked to me. There were two organizations that I became part of, Progressive Democrats of America and Healthcare Now. Those two organizations became very important in my life. And where the healthcare movement is now, I think all of you can help me answer this too. If you look at the movie Sicko, it hasn't aged that much, has it really? It really has not aged that much. Yes, the Affordable Care Act has helped a lot. There's no doubt about that. The reality is I would not have been insurable if the Affordable Care Act had not passed. So we have made progress with Medicaid being expanded. You in Washington have Pramila Jayapal as one of your reps. Thank goodness for her. There's a lot that's really good about the movement for Medicare for all and for the healthcare justice system. But the reality is we have more work to do. The forces against us are powerful. And you know that. It's the money. It's follow the money. Always follow the money. Whether it's the providers and the hospital corporations and how much money they're making, or the insurance companies now gobbling up Medicare through Medicare Advantage, that are really making it difficult for us to get to our goal. However, we will get there. I believe we'll get there. I think it's going to take time. I think we're going to have to maybe do it state by state. I'm not sure about that yet. I still really support the national movement and getting us to a national Medicare for all. In the meantime, however, I think state efforts and the effort that you're putting in now to go to the ballot again, I know we all get weary of having to go gather signatures and get things on the ballot and get people to to really vote in their own self-interest, but we'll do it. We will do it, folks, and we'll do it because you believe it and I believe it, and a lot of people in now a generation down from us and a generation beneath that, they believe it too. So 68% of the American public believes in Medicare for all. The people who don't believe in it, you know who they are. They're the corporate interests. They're the lobbyists who are making a lot of money giving campaign contributions. They're the people who just don't have an interest in securing health care for everybody in this country, but we're going to get there. We'll get there.
Thank you so much. And I think one thing that we all can definitely agree with is that winning in this space necessarily looks like building a massive grassroots people-powered movement. And that's one of the things that going to the ballot allows us to do is we can create a universal campaign for universal healthcare. Even people who cannot sign our ballot initiative because maybe they're not a registered voter can still hold a clipboard. They can still ask their friends and neighbors for signatures, and they can vote themselves a better healthcare system. And I just wanted to show everyone, this is one of our signature Captain Field kits. It has these boards in it. It has 500 signatures for anyone to gather. It also comes with red berets. These are donated to the movement by volunteer activists. They're hand knitted, and they're a gift to every single signature captain. So folks, if you're not one yet, I would love to get you signed up. And you can walk out of here with one of these bags. If you want to gather signatures but not be a captain, then you can talk to a captain and leave with a board with some signatures on it. So I think that that is one of the things that's so exciting about our campaign. And we love the Medicare for All movement. We consider ourselves a part of it, and we want to lead by our example from Washington State. So folks, while we have Donna here, I would love if folks could just come up and ask any questions that you may have. And I'm happy to MC or do any sort of facilitation that might be required, but yeah, feel free.
While they're coming up, I also wanted to mention that I was very close to Jim McDermott when I was working in DC. And thank you for sending Jim McDermott to Washington too. He was a champion for healthcare for so many years and a wonderful guy. So anyway, thank you for that, Washington State.
Sorry to hop the queue just slightly. I did also want to throw out that the Medicare for All bill will be reintroduced into the Senate on the 12th. That is next Thursday. It's being reintroduced by Bernie Sanders, and it will receive its historic second hearing. It only just received its very first hearing ever, maybe about a month ago or so when it was reintroduced into the House. And so this is a big moment. It will be just spinning up our campaign. So it's a moment for us to get out there and ride that energy. But exciting stuff coming up in DC.
Thank you. Hi, Donna. I'm Pam. I'm a retired nurse, 40
Yay,
years.
nurses!
Yay.
Woohoo!
What else? First of all, you look wonderful. How are you feeling?
Okay, I'm doing as well as we can during the pandemic. Thank you
Yeah.
for asking.
Okay, very good. So since the Affordable Care Act has come out, I hope, are you taking advantage of that? Or you're probably on Medicare now like I am. Is that correct?
Thank God, yes.
Yeah.
The day I got on Medicare was one of the happiest days of my life,
Yeah.
literally.
Yeah.
And I had no idea how good it would feel. I know you know that.
Yeah, it took me about 3 months to figure out a Medicare Advantage plan because it's private health care, like you said.
Yes, it is.
And so I'm looking forward to all of this. But I just am curious about that trip to Cuba. and my sister now wants to take a trip to Cuba, like to enjoy it all, you know?
Yeah,
Like,
yeah.
And which I'd like to do that. But was that, I mean, just the emotion we saw from all of you, I just loved it so much. That's the kind of care a bunch of my friend Lana and I did for hospice patients, you know, to try to make them the person, you know, the center of the care. body, mind, and spirit, we would say, and all of that. So that was really beautiful. And I think the biggest thing I see in healthcare is when I started working at one of the major health care companies, I would call them, here in town, where we had one hospital, and I think we have 8 now.
Wow.
Or something, and that's what I see a lot of, and especially Kaiser Permanente as well, taking over areas, like it's the only place you can go. You don't have much choices.
Yeah,
And,
absolutely. And I think you're going to see that more and more
Yeah.
consolidation, which isn't good, obviously,
No. Yeah,
to have so much. And they tend to build these facilities where the rich people are,
yeah,
where the people with money and
Yeah.
insurance are.
yeah. So thank you very much for everything.
Of course. And go see Cuba. It's wonderful.
Yeah, I'm going to.
That reminded me, I wanted to tell a quick story that I've been telling a lot on the campaign lately, which is a lot of people that I work with are on Medicare. I am 31. I will not be on Medicare, presumably for quite some time, but I am on another program called Medicaid.
Yes.
And if we did not live in Washington State, which is a Medicaid expansion state, it would absolutely not be realistic for me to be doing what I'm doing. I'm able to be on Medicaid and have health insurance, and that allows me to become a full-time activist for universal health care. And so that really is what's on the line here. The more that we can empower ourselves, the more we will be able to expand this movement further. I think that there's like a sort of a thing about US politics. I only heard it said this way a couple of times, but if you're not expanding a right to something, you're probably losing it. And so I think that we should always be thinking about expanding this and the strength that comes with that to expand it further.
That's such a good way to say it. My gosh, I agree so much, and I'm so glad that you're on Medicaid. I'm so glad.
We have another question for Donna Smith.
I don't have any in the Q&A.
You are welcome to submit one over Zoom.
Yeah.
Anyone who's joining us online
Yeah.
or on their phone, but anyone who's here today can simply walk up and take advantage of this wonderful opportunity.
Hi, Donna. My
Hi.
name is Sarah, and I'm a financial data analyst. I've worked in the healthcare field for about 12 years now.
Oh boy, you've seen it all, haven't you?
Yes, I have. I worked for the Department of Corrections for 8.5 years. So the Cuba Guantanamo Bay was very poignant for me, having seen that happen. And right at the beginning of the pandemic, I had a friend in the business reach out to me and asked me if I would go and interview at the Southwest Physicians of Washington. And I was like, oh, I'll go and check it out, thinking it was a doctor's office. And I get in for the interview, and turns out they're an accountable care organization, which sounds like a great thing, right?
Oh yeah.
I was like, oh no, I am in enemy territory. And so as the interview progresses, they start telling me how they have all this money. Accountable care organizations are built around providing care to populations of individuals. And with the pandemic, they were in a unique position where no one was coming in for care, right? Because everyone needs to stay home. We're only treating the essential services, and they are getting flooded with money. So they're out there trying to hire more people to find out how to make more money. Is there anything going on in the national or the state space around accountability for accountable care organizations?
Yes, good question, Sarah. That's awesome. I mean, the reality is we need more people who have your point of view, really speaking up and talking about what they're seeing, because I think people don't understand how much money got put in the bank during the pandemic by all of these, whether they're accountable care organizations, which essentially function like HMOs, very much like HMOs. You know, for instance, I had a call, I have COPD, and I had a flare, and I got a call from Kaiser. I'm a Kaiser person, and they have a person who manages those of us with lung issues, right? So, the reality is they get paid a little kicker from the federal government to manage my care. Well, the reality is I probably shouldn't be having too many flares if they're managing it very well, right? And I couldn't go to the doctor for more than a year. My husband has waited for more than a year for cataract surgery.
Yeah.
And from what my doctor friends tell me, it's a surgery that takes about 10 minutes.
Yeah. Right.
You know, and the reality is our system, our accountable care organizations are being looked at like by people like Elizabeth Warren, who I adore. Elizabeth Warren a whole bunch. And I want her to be a co-sponsor on Bernie's bill. So if you have any connections with Elizabeth, give her a call. But the reality is accountable care organizations are just a scheme. They're another scheme in our healthcare system to bundle groups of disease groups, mostly, not always. Sometimes they're population centers, populations around neighborhoods and certain economic groups. And they get money from the federal government to do that, to make sure that people are cared for. And the money doesn't go to care, does it? Do any of us really think all that money goes to care? It doesn't.
They were laying off the nurses at the hospitals at the same time because they weren't being able to do the elective procedures to be able to pay the so the
A lot of them got laid off, which I found mind-boggling. The people in, for instance, I had a hip replacement in the middle of the pandemic, which was really interesting. The nurses there told me that they called them in. They were going to quick do as many surgeries as they could do because they knew they had the time and the window to do it. There were COVID patients in the hospital. So my husband was extremely nervous about me going in to get a hip replaced. And here were these nurses who had not been put to work in the COVID units, who were surgical nurses and probably didn't want to work in the COVID units, but they hadn't worked for a good portion of the pandemic because of the close down of what's called elective surgeries. So, you know, the reality is, folks, what you are doing to gather signatures now, thank you, Sarah, for doing it. Thank you for all of you for doing it. You're educating people, and as we know, educating our neighbors, our friends, our family, even if they really don't think they want to talk about going to some kind of universal care. If you ask them how things are going with them with their insurance or with healthcare, sometimes you can open that conversation a little bit easier and quicker than if you just boom, hit them with the reality that you're a supporter of Medicare for all, or you're a supporter of a whole Washington plan on the ballot. Sometimes just opening the conversation. And then I know those of you who have organized otherwise, you know the 5, 4, 3, 2, 1 thing, correct? Or should we go through it? Don't waste your time on people who can't be convinced. Don't do it. Those are the 1s and the 2s. Just say, thanks so much, we'll agree to disagree, and move on. The people you want to organize really are the people who don't know yet. The people who are the 5s, who are so totally with you, just get their signature, thank them, and move on. Or get them to gather more signatures with you. That's even better. The 4s, yes, they're probably going to sign. Those people in the middle who don't know one way or the other, those people are the ones you're really targeting. The ones we really want to educate. We want them to advocate. And whenever I'm gathering signatures, I always tell people, you're not voting for the measure right now. You're voting so we can get it on the ballot. Let's get it on the ballot and let all of the voters decide. Instead of having those corporate hacks in the back room, hiring people because there's money flowing from everywhere. Instead of letting them decide our health care, we can't let that happen anymore. We can't, and I'd love to see Washington State lead in that regard. You guys are leaders in so many things. And with climate change and so much that's coming up, you know how to advocate for this. Don't let anybody discourage you. I know you hear a lot in the movement about, we don't want these things going on, it's going to weaken us, blah, blah, blah. Don't worry about it. Get out there, organize, get those signatures. We love you, and you're an intricate and important part of what we're doing.
Thank you, Donna.
Thank you, Donna.
So we have a question from the out in Zoom land, and it's from Jenny Alders. And and I don't know if you can answer this, you might be able to, but I think Andre might be able to also. She says, she's asked, I'd love to hear more about Tommy Douglas from Canada. Are there good resources to learn more about him, and why was he so effective?
Yes, I want to tell you about a movie is the next one you want to see. If any of you have never seen Prairie Giant, The movie is called Prairie Giant, and it's the story of Tommy Douglas and the story of what happened in Canada. The movie had to be banned for a little while because one of the people in there swore he was a teetotaler and it showed him drinking. So they had to take it away for a while and then they brought it back. But it is the most fabulous story about Tommy Douglas and starting literally as a preacher on the plains of rural Canada in Calgary, really. And he at the time could not bear to watch parishioners in his church suffer. And he went to be, I'll just tell you one story from the movie because I want you to watch it. It's so good. He went to be with a parishioner who the government of Canada was coming to see if the family needed help. And at the time, remember, we're talking about back in the 30s now, so really Dust Bowl Depression time. The only way the government could tell if someone needed help is they made you lift your shirt, and if your ribs were showing, you needed help. If your ribs were not showing, you didn't need help. And he was so incensed and so angry that this mother had to pull up her child's shirt and her own blouse in order to get help, that he went to the church the next Sunday and preached about it. The people who were in charge of his church came to him and said, you have a choice to make. You cannot preach politics from the pulpit. And he went over to his wife and he told her, I think I'm leaving. I think I'm not going to be able to be a pastor anymore. They're making me make a choice. And that was at the very moment that she told him she was pregnant with their first child. And he walked away from being a pastor. And that was the beginning of Tommy Douglas saying, I can't do this. I can't watch people suffer. And don't we wish all of us had that, or all of the people around us had that moment of enlightenment where they watched someone around them suffering and they thought, I can't bear this. I can't stand it. I know I was raised to help stop it when someone is suffering. I think most of us were. And how we got to the place where we allow this competitive healthcare system when our neighbors to the north, led by a man named Tommy Douglas, and it took a long time. And it was one province first, folks, one province first. The doctors were against it. The doctors went on strike, and doctors from, believe it or not, the United States went up and helped fill the gap until that system could be stabilized in that province. And then it was many years later, it didn't happen overnight in Canada. It was years later that the entire country went to a countrywide Medicare system. So is it possible to do it state by state? Yes, it absolutely is, while still maintaining the vision that every human being deserves health care. So watch the movie Prairie Giant. It is wonderful. You could have a night of watching that. It's a little bit long. It's about 2 hours and 20 minutes long, I think, but it is terrific.
Yeah, and we have done screenings before of a 2-part documentary called Bitter Medicine that maybe tells the story with not quite so much detail, but it is an incredible story. And Tommy Douglas went on to become the governor of Saskatchewan. He ran on a socialist movement. And I think one of the things that's most remarkable about this story, Saskatchewan is not an urban province. It is not a liberal province. It is a rural conservative province. And yet this movement, this healthcare revolution began there. And the other story that I think is really relevant, just to kind of put this in US context as well, right? In the United States, the last federal healthcare reform was the Affordable Care Act, which is also known as Obamacare. And before it was known as Obamacare, it was known as Romney Care. Right. And it came from the state of Massachusetts.
Call it Rombamacare.
Oh, there you go.
The point being that the states have great influence over federal policy, and federal reform, when it happens, there's actually an old Milton Friedman quote, which is that in a time of crisis, what happens comes from the options that are on the table, and we want universal, single-payer, nonprofit, public healthcare to be on the table. Washington State wants to put that on the table.
Woo!
Absolutely. I also want you to know something else about our neighbors to the north. When the Spanish flu pandemic hit this country and hit the world in 1918, there were a group of, imagine this, it facilitated a group of doctors and nurses from Ontario and a group from Detroit who got together just across that river and talked about what would be needed to make that pandemic a little less devastating. And guess what they decided? A healthcare plan that covered everybody. That was in 1918.
Right.
So we have lots of precedent to lean on.
Hi, my name's Adam DeLande. I just want to make a comment about Tommy Douglas. I'm born and raised in Saskatchewan. My family were farmers from grandparents who were farmers. And so I know quite a bit about Tommy Douglas. And I just wanted to say in that regard, he grew up and raised in Saskatchewan, was a preacher that became the premier of Saskatchewan and ended up becoming the Prime Minister of Canada. And I just want to state about the movement in Saskatchewan was the first province that gained universal health care, and it grew from there. And there's kind of a, how do you look at history? And is it great men, or did they stand on a great movement? And yes, he was a great man. He's a great orator. He's a great speaker. But he stood on the back, so to speak, on farmers that met like this. They were the ones that were the foundation of a movement for Medicare for all, not Medicare for all, for universal health care, that they had meetings in Granges, they met all the time, they pushed and pushed and pushed. And then in that push, someone like Tommy Douglas emerged, much like I think Bernie Sanders emerged, because there was thousands and millions of people who said, yes, we are with your movement. Yes, this is what we want. And so to me, the seeds of Tommy Douglas here are you people, the 30 people plus in here in a 120 seat auditorium. Instead of being demoralized, I think we say, we are the faces, we are the seeds that can make whole Washington happen. So it's more of a comment. Like I said.
Yeah, I mean, you're absolutely right on. And we don't know, maybe you will be. We don't know who sits in those chairs right now. We don't know who sits out in your communities. There may be that person still out there, in the United States. Although Bernie Sanders, my God, what a gift to our country that man is. And he has stood alone on so many issues for so long that it takes an incredible amount of courage to be Bernie Sanders. I'll tell you that. I admire him greatly, and I think we all owe him so much for continuing to fight.
I just want to make a comment in regards to how Canada does it, in the fact that they, although every province in Canada has universal health care, it is kind of like administered all differently and separately at each of the provinces. And I'm thinking, nobody wants to, we all want to do things the American way, and don't want to look at how other people around the world do it, but we have to, because they're all doing it better than us. But I think that our state movement can lead the way in creating a Medicare for all and make our healthcare system more individualized at the state level. And because it is true that the states know what their people need more, or maybe sometimes there are some states that just don't take as good a care of their people as other states. And did I say that? Anyway, and Medicare can kind of become an organization or part of the government that just oversees and has minimum standards. And if our states want to go above those minimum standards, they certainly can do that. Anyway, that was just my point on that. And I wanted to say, though, that I'm really disappointed that Michael's not here, and I'm gonna be yelling at him. And now I think that he really will owe us, maybe we'll be able to have an online session with him after.
There you go. Maybe he goofed up the time. It's possible he goofed up the time.
Well, I sent him the reminder an hour before, like he asked, because when he replied the other day, he's like, "Is this Pacific time?" Yes. He says, "Whatever you do, send it the link 1 hour before, no longer. I get 1,000 emails a day." It's like, I got it. So I did. And you figured it out. So he can't say he couldn't figure it out.
Yeah, he owes you one.
So watch our website. Okay. I want to mention a couple of things though, because we are kind of running out of time. We only have this space until noon. Oh, okay, and Andre needs to say.
Sorry.
Okay.
I really can't let you off the line, Donna, until I ask. So I think you've given us some great advice. Progressive Democrats of America has all sorts of institutional knowledge about how to build and run campaigns and movements. But my question is, what grassroots organizing advice would you give us, and what can Progressive Democrats of America do to support Whole Washington's campaign?
Good questions. I think the most important thing organizing is don't burn yourself out, believe it or not. You're going to have superstars who want to go out and gather those 500 signatures, and that's great if they can do it. But I have found for myself to set a pace, set a pace 3 or 4 hours a weekend or whatever it is that will work for you. Don't burn yourself out so you don't want to have anything to do with it anymore, or you're tired of it. Also, reach out to younger people around you. That has a double benefit for organizing, in that we get more youngsters like our 31-year-old MC, who I'm so jealous that he's 31. We'll get more people who are younger, and it's so great to have them in the room, their energy, their expertise. And door to door is hard right now. It's not a good option. We have found that libraries, believe it or not, a lot of people are going into libraries to use computers and do different things. We've gotten a lot of signatures outside libraries to get candidates on the ballot, to get people on the ballot. The other place, believe it or not, that's wonderful, I don't know if you have very many public hospitals. You probably have a few around who wouldn't mind if you were around the parking lot or around the sidewalk. You're not harming anything. You're just asking people for signatures. And nurses, tell people you're a nurse. People love nurses. You are the most respected profession on the planet. Please tell people who you are so that we can thank you for your work during the pandemic and so that you can get more signatures. You are the secret weapon. You really are. The other thing the nurses taught me that's really weird is feed them and they will come. I was always so shocked at the food buffets they had out everywhere. But it was so true. People would come. So if you're going to do another signature gathering training event, which is great, I think you should, is do some food, do some fun, do a chili cook-off. We did a chili cook-off once. Be fun about it. Just have fun with it. How long do you get to gather signatures? How long do you have?
Oh, we have to.
Until December.
Oh, perfect. So you could almost do something every month. Get in the habit of every month doing something. I think that has been one of PDA's best successes, is that we get people in the pattern. Also, another way to do it, go to town halls if they have them, or get on the phone with town halls, with your reps, with your senators, and make sure they know you're out there doing it. If they don't already, they probably do know, but get out there and do it when you can. You have so many beautiful places where you could go gather signatures while people are out and about right now. I know that you will have some energy to do that. PDA would like to help. If we can help, one of the things we can do is send out messages to all of our PDA members who are listed in your state. So when you get ready to do another event, or you just want to make an announcement, please send a draft of something my way, and let's see if we can get PDA to send out an email for you. Or we could have you on one of our, we do a Sunday town hall with Dr. Bill Honigman. I don't know if you've been on those at 2:00 every Sunday afternoon. The poor man's done almost 120 of them since the pandemic started. Why don't we have Whole Washington on one of them? That would be great, so we could tell people. So there's some ideas. I have lots of ideas. So anytime you need them, I'm happy to apply.
Thank you very much. We would absolutely love to coordinate some of that with you. And I will say that we've got to wrap it up. But
Perfect.
I just want to make an official ask on behalf of Whole Washington in front of everyone today that we would love to pursue an endorsement from PDA. I know that every organization has their own process for that.
Yes, I will put it forward. I will put it forward for you.
Thank you very much, Donna.
Yes.
would love to get a quick
group
group
shot
shot with you in the
everybody up
background,
here?
Donna.
Okay, and
Okay,
now,
let's go.
while everybody's coming up here, you want them up here?
Yeah.
Yeah.
Yeah, full screen.
Yeah.
Donna.
Yeah.
Going
Oh,
her-
Can
her
can you
side.
make her full screen? I don't know. We were
I
trying to
think you
get
just
rid of
double
me
click
and
it.
the other
On
one.
that and then.
Oh, try double clicking it,
Just
Doug.
don't let me see me full screen.
Okay, while you're coming up here, I want to make a
for a
couple
quick second.
reminders regarding
Aside.
future events. One that's
There you
coming up is going to be through with the Red Berets. And there's going to be the release, or there's going to be a pre-screening, private screening of Healing Us, which is a new documentary by Penny Valentine. We weren't able to show it now today, but you can go to archivistentertainment.com and you can go see the trailer there. It's going to be on June 4th, maybe June 11th. So watch our website to find out the exact date when it's coming up. Also on July 23rd, the Confessions is doing a concert for us on Vashon Island at the Vashon Island Community Pub. And that's going to be an awesome thing too. So mark your calendars for July 23rd and either June 4th and June 11th for some big events for whole Washington. Okay.
Real quick, Donna, look up
Oh,
at
I
your
see you
camera.
all.
Donna, look at your camera and look at your little lens. Where the-
What do you want me to do?
I want you to look at the
Right,
camera.
exactly where she's
I'm looking at the camera.
Perfect.
And if everybody down there, if you can't see the camera can't see you, so just you can see me. All right. We're saying Medicare for all on 3, 2, 1.
Medicare for all.
Stuff. Awesome, thank you.
All right.
As we leave here today, there is a protest downtown at the federal courthouse for reproductive rights hosted by Tacoma DSA and other coalition members. So
Love you
it's a
all.
good.
Thank you so much. Bye.
Thank you, Donna.
Bye.
So just, it's right down on Pacific Avenue, very simple. Let's swing by and see if we can get some signatures there.
Also, if you're in the neighborhood at between 2 and 4, we are also supporting National Nurses United and doing a QR code petition for their petitioning QVS pharmacies to not continue supporting the dark money groups that they support that are fighting against Medicare for all. So we need about 20 people at the CVS pharmacy on South 23rd. Okay, if we can get a few people during that time, that would be great. It's from 2 to 4, okay? All right.
Hey, I'm Lana, and I'm a volunteer. I'm also a nurse, retired. So I guess we're supposed to tell everybody that. From now on. I just want to let you know, thanks to everybody for coming. Down in the lobby, there's some petitions you can sign or outside. And also there is a little bit more information, and there's also a jar which you can donate if you would like to. So go down.
Donate, no, you need to fill out one of these.
Right. Thanks, Jen. Yeah, I'll take those
I got
now.
it. Okay, thank you.
And so thanks to everybody for coming. I hope you can become signature captains. It's just a really, this is just such a good cause. We need to have healthcare for all. Thanks.
Absolutely. So I spent a year on the road. I don't need the mic. I spent a year on the road with Bernie. Oh, okay. Oh, I didn't really. So I spent a year on the road with Bernie. I heard him speak about Medicare for all every day for 264 days. The thing that will get us to where our friends up north are, our friends all over Europe are, all over really the developed world, will be these rooms, these meetings. It won't be some big advertising scheme. It won't be some big messaging campaign. It will be individual seeds being planted that will grow into this forest, kind of like the way the forest grows. I don't know. I didn't have a speech or anything. I've seen groups like these turn rural podunk towns in the middle of nowhere into progressive hubs, literally by going to the towns and telling people the truth in ways that they can hear it rather than what some advertising campaign group made up in a boardroom. It's people who actually know how to speak to individuals, where they're at, how they're hurting, and relating those pains to something that you've lived through, and I've lived through. And that's really where this is all going to go. And as long as these meetings continue to happen, They're going to get larger and larger and larger until there's no more, big bad Fed. There's just a lot of little hubs of seeds that have turned into this massive forest called America. Hopefully that we can turn something into where we failed in the campaign and continue growing on that, and individually the ideas that you all have, bringing those to the table, because there's a lot of things that we didn't do right on the campaign. And being here allows me to relay back to the teams here in DC, in Washington, and California, exactly what they need to hear. So thank you for letting me come out. Whoever invited me, yeah.
And thank you very much, Lana and Pam, for helping out with getting this coordinated. They both volunteer here, and what an awesome theater. Thank you to the Grand Cinema for letting us use your facilities. It's awesome. We so appreciate it.
I see Mariana, our board, the chair of our board, in the comments, and we just want to say hello, Mariana. We love you.
All right, so we're technically supposed to be out by noon, so if you can go down and your signature, Captain, and make sure you grab a bag and let us know how many you're taking, if you're taking some for other people in your county. Yeah. Okay.